and I'm one of the health reporters here at Politico, and I'm here today to host a very important and timely conversation about mental health in Europe. Mental health issues affect a large number of people in Europe. About 1 in 6 people approximately accounts for about 4% of GDP, and yet countries are chronically underinvesting in mental health. Mental health really only amounts for about 1% of health expenditure in European countries. Now, the coronavirus pandemic has only made this worse as we see increasing numbers of people with anxiety and depression. So what should we do about it? We have 4 interesting people here with some different ideas. I'm going to introduce them first. We have Hilka Kerkkainen, president of Gaming Europe, a mental health advocacy group. We have Celso Aranjo, chair of the psychiatry department in Spain's Hospital General Universitario Gregorio Maranon. Hopefully I didn't mispronounce any of that. We have Maria Walsh, an EPP MEP representing Ireland. And we also have Emily Hewlett, a health policy analyst at the OECD. Thank you all to the speakers for being here. We also have an additional speaker waiting in the wings who's going to offer a different perspective, maybe challenge a bit of what's being said. But I also want to remind you that you can also ask questions. All you need to do is go to Slido, sli.do, either on your computer or your cell phone, and you can ask your questions there using the hashtag #MentalHealthEU. You can also make sure to tweet out about the event on Twitter using the same hashtag #MentalHealthEU and tag events Politico. We also have a first question to get things started for you, the audience. You can log on with Slido and answer the question, what is needed to make mental health matter more if you had to choose just one thing? Your options are more funding, more research, and more prevention promotion. The poll is now open and live. Please tell us what you think. I also, though, before we get to the panelists, I want to thank our sponsor, Angelini Pharma, for hosting this very important conversation, and let their CEO, Pierluigi Antonelli, get things started. Pierluigi, the floor is yours.
Thank you. Good morning, everybody. COVID-19 has had dire impacts far beyond its physical toll. Millions of Europeans have suffered severe emotional stress from fear of contagion, grief for family members, social isolation, and financial anxiety, all of which has contributed to a growing incidence of domestic violence and addictive behaviors. Now, according to the OECD, about 84 million Europeans suffer from mental health conditions, including anxiety and depressive disorder, bipolar disorders, drug and alcohol addiction in 2018. Now, the proportion of Europeans feeling major depression has more than doubled since then, from 6% in 2018 to 13% in April of this year, and loneliness nearly tripled. With a new wave of lockdowns, which are gripping Europe, we must ensure affected communities have access to mental health support services they desperately need, actively supporting them to increase awareness on the burden of their conditions and break the stigma surrounding them. These problems have steep economic costs as well. Even before COVID, mental health issues accounted for about 22% of Europeans' work disability time, and the consequent productivity loss cost between 3 to 4% of EU countries' GDP. In 2010, the total cost of mental health issues in Europe was estimated to be close to 800 billion, more than the 750 billion stimulus deal agreed in July, the so-called Recovery Fund. So why acting today? The COVID-19 pandemic provides us with the opportunity to improve European mental health services and policies by putting in place the lessons learned from the emergency. It is the occasion to set mental health into the spotlight and at the very top of the European public health agenda. The pandemic only further emphasized how health in general and mental health in particular significantly impacts on all economic and social sectors of society, and how it is of crucial importance to continue placing the concept of health in all policies at the top of the political agenda across all countries, regardless the extent of the emergency. Fortunately, following European Commission's proposal for 9.4 billion euro funding for the new EU4Health program for 2021-2027, dated July 19 of this year, the European Parliament adopted a resolution putting out and setting out the pillars of the new public health strategy in the post-COVID-19 era. The resolution also recognizes mental health as a fundamental human right and calls upon the elaboration of a European action plan on mental health from 21 to 27, in which equal attention should be paid to the psychosocietal, psychosocial, and biomedical factors on the mental illness. The resolution also underlines that the long-term health effects of COVID-19, including the impact on mental health in people with disabilities. Now, I'm firmly convinced that mental health services must be incorporated into every aspect of the public health planning, implementing the approach of mental health in all policies recognized by the European Parliament, and integrating formal and informal outreach and service delivery through community networks. We cannot and must not keep on considering physical and mental health as competitor in the hierarchy of people healthcare. On the contrary, we must ensure that mental health care will be receiving the same priority as physical health treatment, both on the financial and on societal standpoint. On a personal note, I was moved into action when an employee of mine reached out to me to discuss her attempted suicide. She wanted to share this with others at the company to provide support and inspiration for those who may need it. And therefore, I made sure that she did. And together, we created a comprehensive mental health support program for our company, which has been very invaluable in this period. Now, our goal should hence be to transition from a system that emphasizes management and healthcare in institutional settings, namely hospitals, to a more inclusive approach that reaches individuals with mental health messages and services in their everyday lives. This will enable earlier diagnosis and treatment, which will in turn improve care and lower the economic cost of the disease. COVID-19 has brought into sharp focus the systemic gaps and shortcomings of the healthcare systems across Europe, and we can turn this strategy into lasting reform by taking concerted action now to treat the pandemic physical and psychological aspects and impacts together. If we succeed, it will mean a quicker and more robust recovery and also a brighter future for all European people in the future and in the years to come. Thanks for your attention and have a good continuation of the meeting.
Pierluigi, thank you so much for those comments. I think it really shows how important mental health services really are here in the EU. So I'm really excited to get this conversation started with the panelists. I'm going to kick things off with a rapid fire question. I'm going to be nice and give you 30 seconds each to answer this, but I want you to choose one thing. If there is one thing that can make mental health matter more, some of the things that we have for our audience are, of course, prevention, funding, research. I'll let you choose another thing, but if you had to choose one thing in 30 seconds, what would that thing be? Maria, let's kick things off with you.
Never, when you give a 30-second time frame, never start with the politician. For me, making it a competency, mental health a competency of the European Union would, in my eyes, force conversations that mental health isn't at the top of the agenda in some countries, and put money where the mouth is and mouth where the money is in terms of other countries that sometimes subsidize, but not to the extent it needs to. So making it a competency would be my number one thing.
Absolutely, man. You did that quite well. So thank you for getting us started. Emily, how about you?
I think there are lots of things, but I will limit myself to one thing, and I think that would be promoting, really changing and promoting awareness of mental health, good mental health, and mental health issues, focusing on stigma and mental health literacy, because that has knock-on effects across the whole of the rest of the mental health picture in terms of services, access to services, funding, awareness, and the whole picture really.
Absolutely. And Celso, your turn.
Thanks. I don't know if you have noticed that you gave us three possible solutions, but no one has so far has chosen any one of those three. I would for sure go with funding. You know, funding is always necessary, but I would completely agree that we cannot get funding if we don't increase visibility. And that's what is needed, increased visibility. And And I'm pretty certain that most European citizens are not aware that 1 in 4 Europeans will end up with a psychiatric disorder along their lives, or that suicide is more common than traffic accidents. More people die from suicide, or the suicide is the second cause of death, of mortality among adolescents. So there are many facts that are not known out there that I guess they will help to increase the funding for mental health, and especially what is most needed for sure is the prevention and promotion of good mental health and good well-being.
Absolutely. So I see you kind of chose two things: awareness, but mainly funding. Hilka, your turn. Last but not least, if you had to choose one thing that you really think is important to get mental health services out to people, what would it be?
Well, if I had to choose one, I would choose the same like Celso. I would choose funding, because it's been proved that 1 euro spent to mental health brings back 4 euros into society. And funding also, because I think that that patient organizations are doing a very good job in mental health area, and patient organizations should have sustainable funding to do this job. Thank you.
Absolutely. Now, thank you so much. And thank you all for getting that conversation started. Now, I want to dive a bit deeper, of course, into some of the things that you said. Now, Emily, I want to start things off with you. You've talked before about the chronic lack of investment in mental health services. I'm curious, we have policymakers watching. What is your sales pitch to politicians and policymakers to start investing now, today, in mental health?
It'd be exactly what Hilke just said, which is an investment in mental health is very much a cost-effective one. We know that countries are not spending as much as on mental health as the burden of mental illness would perhaps suggest they need to, but in particular, they're not spending as much as the economic burden of mental ill health would suggest they need to. So many of the high economic costs of mental ill health don't come from treatment and from care. In fact, they come from losses elsewhere in society. So lower rates of employment, less productivity when people are in work, more days off sick, and also people not being able to fulfill the potential that they would like to be able to. So people not doing as well in school as they could if they had better mental health support, people not doing as well in university, people struggling more with the school to work transition, and so on. So really an investment in mental health is not only not only part of securing the right to good health for all as part of that, but it's also an investment in healthy, thriving economies and societies.
Absolutely, thank you. And Sasso, you made an interesting comment about the financing, right? That you need a proper awareness of mental health before you can even get that financing. I mean, working as in a psychiatry department in a Spanish hospital, what are the main hurdles to getting people to understand mental health?
Right. So, we know that many people suffer from mental disorders in Europe, and they don't get help. They don't get help because they think, they cannot be helped, and some suffer, the fear to ask for help for something they consider is stigmatized and will cause problems to them with family, with friends, with employers. So that is that stigma around mental health that differentiates these disorders from other medical disorders. But as it has been said, we shouldn't be talking about spending. It's an investment, and we have really good data from London School of Economics that for each pound, for each euro that we invest in mental health prevention, mental health treatment, we get for some conditions 60 times the amount of money that we spend. And we should not forget that mental disorders, just by themselves, they cost 22% of the Europeans' burden of this disability. So it's a huge, and that especially is in the sector of young people, because 70% of all mental disorders start in childhood and adolescence, and many of them, are chronic. So they go with the person during their entire life.
Absolutely. Now, I want to throw it to Maria, because you said that you want for mental health to be an EU competence. I cannot but wonder, we're struggling to even have emergency health powers be made an EU competence. So what do you think, why do you think it's important to make mental health an EU competence, and is that possible? Is it likely?
Will it be likely within this mandate? No, I don't foresee that. However, one of the opportunities with that we're seeing and we're existing in COVID is the fact that more and more of our communities, our policymakers, our leaders in government are understanding the impact of our mental health, because everybody has it. And adding on to the panelists' comments, it's prevention is cure. We need to get support for community members at the top end of their life. So we have younger people now existing through a series of transitions that are greatly impacted because of COVID. So what are those transitions? Well, difficulty prior to COVID, it was like difficulty in a paper, a relationship breaking down, figuring out their own sexual identity, having that conversation with close loved ones about that identity. Here in Ireland, we have a great organisation called Jigsaw that its sole focus is for prevention. So supporting adults and young people through periods of transition, because we're lifelong learners, so we're going to constantly keep evolving and growing. But what we have now is COVID has only expedited the fact that we've had band-aids over several mental health facilities, capabilities, preventions, cures, reactions across each member state, and piecemeal of funding going out. And unfortunately, that's not good enough. I mean, here in Ireland, we had €1 million at the top end of COVID launched into mental health online support services, predominantly for younger people to have those supports now. But I mean, realistically, wouldn't it be great if, utopia for me is in a European Union that if I'm in Ireland and I travel to anywhere in the European Union, I have the exact same mental health care. If I have a trigger, if I just need support. And it's not as many have said, it's not just the mental health that what we might hear about or some might fear or what people are existing with. It's the fact that we all have it. We all have experienced it at a more exacerbated rate because of COVID. We're asking people to work from home in a confines that they might not be used to. We're asking people to educate their kids at home, which they might not be used to. And then we're asking them to, don't worry, we'll get it sorted for you. And now is our time. We're at that crossroads. And GAMI in Europe has been cheerleaders in this for us in the European Parliament, that we have an opportunity to make sure mental health is at the forefront of finance ministers right across Europe in the institutions. We just need to wake up and realize that to talk about the best trade deal or currency or what we're currently living in now with Brexit, COVID, you have to talk about the person, and the person has to be talked about in a holistic way. And that's not just physical, but that's also mental.
Absolutely, Maria. I think that utopia sounds wonderful, and I actually want to talk briefly or very soon about how COVID has impacted or possibly woken up some politicians. But first, I'm really curious because Hilka actually has an interesting idea as well. You were saying, Maria, that you want mental health to be an EU competence. She's talked in the past about a mental health strategy across the EU. Hilka, I was wondering if you could elaborate on what that would do for EU citizens and what you would want to see in that strategy.
Well, I think that EU mental health strategies should have focus on national mental health strategies. We had here in Finland a new mental health strategy beginning of this year, and it's I think it's important to have first of all to explain why do we need mental health strategy, and then mental health policy guidelines, and also in the strategy there should be also measuring mental health, how you do that, and monitoring, and also expenditure, because the finances is very important in this strategy too. So I think that although it's good to have EU for health program, we still need mental health strategy, because EU health program is focusing on non-communicable and chronic diseases, but above that we need also EU mental health strategy.
Hilke made a really interesting point there that there is this EU for Health budget. We've got 5.1 billion euros in that program, but a lot of that's going to go toward cancer, chronic disease funding. I want to ask Emily. We were talking earlier about, or people mentioned that COVID has maybe woken up some politicians and realized how big a deal it is that mental health is affecting so many people across the EU. Do you think that they've actually woken up, and do you think that the EU for Health will actually end up including some kind of mental health strategies, programs?
Well, they sound like good questions for Maria, but I can maybe say something about what I think that the COVID crisis has had in terms of awareness of mental health issues. I would say it's striking the number of countries who have included mental health as part of their COVID recovery programs. So both as part of their health protection interventions at the beginning of the crisis, but also throughout the course of 2020, investing attention and also resources into making sure that people have more support than they had in the first place when it comes to mental health. Some of those are fairly low threshold interventions, things like access to phone lines or information being made available about coping and protecting mental well-being, whereas other of them are slightly more intensive, so things like scaling up services or ensuring that services can be accessed digitally, including some new packages of services in countries. I would hope going forward that this awareness continues, and that it is also broadened out into an awareness of the fact that mental health isn't just a health system issue and isn't just an issue for health ministers to negotiate with ministers of finance, but it's also an employment issue, an education issue, and a whole of society issue. When we talk about the costs of mental illness, they really show up in the employment sector in terms of disability payments, sickness absences, unemployment benefits. So if we want to make a really meaningful difference to the way that we approach mental health, it does involve a true cross-government effort, and it involves ministers of employment and labour taking mental health issues just as seriously as their colleagues in the health ministries.
Now, Maria, I'm going to throw this back to you in a second, as Emily said that you definitely would be one of the best people to speak about this, cross-government approach. But I also do want to ask you, Emily, you had mentioned in the past too, governments are investing a little bit more. At least part of their COVID recovery packages include some mental health provisions. You've also mentioned though that more governments are starting to even just do more research in mental health. Can you elaborate a bit more on what they've found so far?
Some governments have, from the very beginning of the crisis, been tracking levels of mental distress in a new way. So we've seen a small handful of governments, for example, Belgium and France, from the beginning of the COVID crisis, track different types of mental distress, including broken down by different population groups. Unfortunately, it's great to have this new information. Unfortunately, what it has shown is significant increases in mental distress, in particular amongst young people, amongst people experiencing unemployment or job insecurity, and people experiencing financial difficulties. These government-led efforts to track mental well-being have been equaled, if not exceeded, in huge efforts by researchers from universities and institutions across the world to try and make sense and take stock of the impact that COVID-19 is having on mental health and well-being. And again, they're showing similar patterns. So worsening mental distress, and in particular, high levels of mental distress amongst population groups who we already knew were particularly vulnerable to mental ill health even before the crisis.
Absolutely. And so Maria, so Emily was just talking about, we're seeing increasing mental health distress across the EU. Do you think that the EU for Health budget is going to have any impact on that?
I think, much to your point before, as you were asking the question to Emily, there's a lot of, and this is not me being disrespectful to the other issues we have within our healthcare system overall. I'm just specifically mental health, but there's a lot going on. There's a lot taken from the pot of money that it is, and then unless we have every part of society looking at mental health as if they need to protect and mind their own, talk about their own, as well as the person left and right of them, then you end up just moving mental health down the priority list. When in actual fact, if you look at something, and I know my own party, EPP, is very vocal on the campaign strategy around cancer, and that's wonderful, that's fabulous. However, a part of cancer is the mental health of cancer, not even just the person who unfortunately was diagnosed with cancer, but also their support system around them, watching a loved one struggle through the impact that cancer has on them. And then their community gets wider and you spread out, and then you're talking about service users and you're talking about communities that support the service users. So each and every one of us have it. And I said earlier, we need to make it everyone's business. So for me, and in answer to your question directly, the aim of the game is we need to just make sure mental health just continues to be at the top of that priority, and while making it a competency. I know Gamian and I are, and many of the MEP alliance groups that we have on mental health in the Parliament are really trying to create a European year of good mental health in this mandate. And what that means is, while it doesn't have direct impact on policy or no funding is attached to it, it forces conversations at levels when decision making happens around what funding to go where. It forces those, lifts that stigma, talks about it, and just makes it a realistic goal for us all to have, that each and every one of us in our communities, but more importantly, our younger people coming through, as Emily had shared, the most impacted in terms of youth unemployment, difficulty in transition periods, as I mentioned earlier, that they're protected as best as they can going forward, so that in 5, 10, 15 years' time, we're actually leading the way on a European front in mental health, versus consistently being quoted that, well, you're going back, or your 4% of GDP that covers mental health impact is now 8%. That's just not good enough in today's climate. Not good enough at all.
Absolutely. Now, Celso, I'm going to ask you in a minute just about what this actually looks like for patients in hospitals that you're seeing. But first, I want to ask Hilka, because you live in Finland, and Finland actually has a pretty good track record for mental health services. I was wondering if you could elaborate on what they're doing well, but also what hurdles, what problems you're still seeing for patients actually accessing mental health services in Finland.
Yeah, it's true that in general in Finland we have mental health care is pretty good, and also prevention, and at schools we have actually in school curriculum we have teaching of mental health skills. We call them emotional skills, and I think it's very, very important to teach already to children emotional skills, and But the problem is that because in Finland, municipalities are responsible of healthcare and healthcare systems. So the problem has been that in some municipalities, mental health care is taken care very well, but in some municipalities not so well, and that's because the municipalities can they get the state subsidies, and then they can decide themselves how they use those state subsidies, and some municipalities put more money into healthcare and the others into infrastructure. So it means that the mental health care is not equally taken care in Finland, and especially here in Helsinki area. The problem is that it's very difficult to have access to care. It might take several months, and it's also the question of not having enough psychiatrists and people in mental health care. But now we have this initiative that citizens collected more than 50,000 names to have this so-called therapy guarantee to be in the parliament, to have a law to have a therapy guarantee so that people can have access to therapy when they need it. So that it's a kind of short therapy. It doesn't need to be a psychiatrist to give that, but a mental health care professional, a mental health nurse, or psychologist, and those. So it's a short therapy and that you can get, and then if that's not enough, then you get a referral to special care and to psychiatrist within 1 month. So so that would help quite a lot, because now you might have to wait even 3 months or longer to get a time to special health care to see a psychiatrist, because there's this kind of threshold. You have to go to a health center first to get a referral, and then after that, it still takes a lot of time to be on a queue to get to special care.
Absolutely, Hoka. Yeah, 3 months is a very long time for someone to wait. Now, so also I'm curious. I mean, is Spain also facing similar issues? And I also wanted to take one of these questions from the audience and ask you. They asked, is the burden of mental health actually increasing, especially, and they say COVID apart, but I'm actually quite interested in how COVID has impacted mental health services in Spain. So, what do you think?
Okay, so couple of answers. The first one is not all European countries invest the same amount of budget in mental health, and it is very heterogeneous. I wish we were in a situation as they are in Finland. And by the way, Hilke, you should mention this great initiative that you have had in Finland, in which you had included in the curricula of in primary schools the subject of mental health, because I think that's the time where small children need to be aware of the importance of well-being and good mental health. And I wish we had that. We in Spain have not had a strategy of mental health for more than 7 years now, and the percentage of the budget of health budget that goes to mental health in Spain is far below the mean of the European Union. Is less than 5% of the total budget for health. So what issues are we suffering here in Spain? Waiting list, of course, and the ones that suffer the most are the ones that are in the middle. So if you're really sick, you will have a bed in the hospital. If you just need to see your psychiatrist, your psychologist, once a month, once every 2 months, that should not be a problem. But those that need more continuous help and that need to be treated like in day hospitals or need a more continuous assistance are the ones that are really suffering the most. Less than 10% of the people with severe mental disorders have an employment in Spain. That means more than 90% unemployment rate among people with severe mental disorder. That's huge, and that should not be the case. And what's going to happen with COVID? Well, with COVID, things are going to get worse, and it's common sense. Whenever we have a crisis, who suffers the most? Poor suffer more than rich. People with disabilities suffer more than those that do not have disabilities. All crises, regardless of what crisis you're talking about, will increase the gap between the more vulnerable population and the ones that are in a better position to confront the crisis. And that's the case for people with mental disorder. So we really need to make sure that they are not left behind or not more than they are. And who are the first ones who lose their jobs when there is a crisis? When there is an economical crisis, that's people with mental disorders. Here in Spain, we have seen that people with mental disorder are more likely to be infected. If they are infected, they're more likely to have a worse prognosis. So they're more likely to be admitted in hospital and more likely to die from COVID-19. We need to make really sure that whenever we have the vaccine, people with mental disorders, many of them are homeless and will not ask for that vaccine, are not left behind.
Absolutely not. There are definitely some really terrifying things there with how COVID is really exacerbating mental health issues, especially for marginalized communities. But I'm also really interested. We are putting a lot of this onto government, saying you need to invest more. But I'm also curious. We have more and more people working from home, and what is the obligation? What is the responsibility for offices, for employers, to ensure that their employees maintain good mental health? We have a very interesting speaker who's going to talk a bit about that. We have Stephen Bevan, head of HR Research Development at the Institute for Employment Studies. Stephen, you've conducted a lot of research on this. What do you think the responsibility actually is for employers to maintain good health for their employees?
There's a legal duty of care towards the well-being of employees, and that's enshrined in most EU member states, and there's an EU framework directive that requires employers to carry out risk assessments and so on. So that's a sort of legal responsibility. I'd also say there's a moral responsibility. We certainly found in the surveys we've conducted across different countries, looking at how mental health has been affected by working from home, that certainly mental health has got worse. Secondly, it tends to be younger employees who have more problems, and those people with perhaps precarious housing or financial concerns and so on. I think employers really need to adapt. You can't see someone face to face. It's more difficult to identify body language or changes in people's demeanour that might give you a very early warning that they're suffering from distress. So we need line managers and supervisors to be better trained in spotting those problems. We also need more employers to be offering perhaps online or telephone-based counselling services and access to occupational health services. So I think that employers really do play an important part in this, but also to do that in conjunction with healthcare services as well. So this is something that where employers are feeling their way, I think they're very worried that it will have a long-term impact on productivity and on performance. And it's something where I think good employers are already doing some very imaginative things.
Absolutely, Stephen. Now you're talking about imaginative things that employers are doing to tackle this problem. Other people who are doing telephone services for their employees. But I mean, how widespread is this? Are there really that many employers who are implementing these kinds of things?
Well, I think it's very common to say that small and medium-sized companies struggle in this area. And that's true to an extent that they don't have the financial resources to pay for a lot of external support. But actually, many of them are very agile and flexible in the way they manage people. And I think that many of them are doing really well to help people to be flexible in the way they work. We know that people who have caring responsibilities for children and elderly relatives suffering more, and lots of organisations have been very good at offering flexible working and helping people to manage the boundaries between their work and their home lives. We've seen some larger organisations doing some quite good things about risk assessment. So one of the things we know from the sort of psychological point of view is that if the demands of your job exceed your resources, the resources you have to manage the distress that you're suffering, then you're more likely to develop depression and anxiety. The OECD has done some good work on this, looking at the concept of job strain. And so giving people flexibility to make adjustments to the demands of their job, either the pace at which the job is done, the order in which they do their tasks, how much autonomy and control and discretion they have in their jobs, gives people a lot more flexibility and allows them to feel they're in more control and better able to cope with the pressure of work. And lots of organisations are allowing much more flexibility than they would do normally if people were based in physical workplaces.
Absolutely. It sounds like that better flexibility is actually an investment for employers to invest into their employees. I wanted to bring this to audience questions now, as we have quite a number of them ready. The first question I want to throw to Celso, it was about, actually, let me find this again. It was about mental health for people. Here we go. We know that minority stress has significant impacts on the mental health of marginalized communities. What can the EU do to protect the mental health of these groups? This is something that you were ending on before I threw it to Stephen. So Celso, what do you have to say to that?
So this is about minorities.
Yes. So I can refresh that. Is what we know that this is affecting marginalized communities more, and what do you think the EU can actually do to address that?
Right. So that's a really important question, and we know that one of the major risk factors for mental disorders, including psychosis and depression, is discrimination. And people that are in minority, whatever minority that is, are in a higher risk to be discriminated. And the prevalence of mental disorders among immigrants it's larger than usually the people, the original people from that live in the country, and that's probably because of all the stress, trauma they have gone through, plus the lack of acceptance once they get to the country that they are living. So that's an special population that are very vulnerable, that are in need or of special programs that take into account cultural issues that we cannot medicalize or think that some of the issues that they have are psychological problems, because they're sometimes they're cultural, that we have the proper people that can talk their language and can understand their context, and that rarely happens in most of the EU countries.
Absolutely. Now, Maria, I also want to ask this question for you. What do you think the EU's role is, especially in making sure that people who are part of marginalized groups, their mental health is taken care of?
Yeah, well, a lot of it comes down to not just funding, as we had mentioned, but also to look at. Maybe I'm a little bit frozen, am I?
We can see you okay. I think you were frozen at the very beginning.
Oh, in an attractive, there we go, in an attractive image. Sorry about that, so early in the morning. But in terms of the question, and Sasso is completely right. And I don't want to keep believing that, funding is the answer. It is in many ways, but then how does that trickle down into community groups that are either new into the European Union, that are living in rural, isolated spots, that are living in urban spots, and it coincides with funding, it coincides with education. Those that are welcoming in new community members to understand the experiences, or at least want to understand the experiences that new community has gone through, and then we just need to ensure, if we're specifically looking at asylum seekers, who are coming into the European Union. I mean, I call for in all amendments in all speeches and with working with all colleagues that we have translators on site as soon as a new person comes into the country. We have mental health supports at the point of entry, so that we can actually support the citizen who has gone through what we can only imagine they have been through, and that it's not left to just wait, lack of communication. That there is actually an urgency into making sure they're being either welcomed into their community, into their new home, and that the support service is there. That it's not just you're moving from A to B, months in between, and then no support at the top end or the back end of their new European way and of living and life as a whole. But we have a lot more work to do on much like Hilke was saying, in terms of like classrooms, in terms of understanding our younger populations, and not always putting it on them or the teachers or parents, but like understanding the DNAs, the cultures in our communities, understanding what mental health aspect of our life, be it that you decide to move away or you're welcoming a new community member in. But a lot of it is around education funding, lifting that stigma, and being a little bit more, not a little bit, but being more welcoming to those that have overcome a lot more than perhaps than I have.
Absolutely. Now, you also mentioned younger people. Hilke, I'm very curious because we've heard a bit about how Finland has actually invested in making sure that mental health is addressed in young populations. And we also have a question, of course, from the audience asking about what can be done for young people. Can you elaborate a bit more on what Finland has done to address mental health in young people?
As I said already, that we have this emotional skills in school curriculum, and children at school are taught emotional skills. It's like you are first the children are taught to first to recognize the feeling and to kind of that it's the feelings are allowed. And you learn to name the feeling, and then you start to you're taught to empathize with other people, and you have these role playing ways of teaching children. For instance, the teacher is the teacher can tell a story about, for instance, a child who's been bullied, and then the teacher can ask the children, how would you react if you were the kind of the victim of the bullying, and what would you do, what would you say, how would you react? And children are learning that way, how to empathize with different parties of this quarrel. So that's one thing. Well, one thing I would say that it's not very well in Finland is that we have, in my opinion, this is purely my own opinion, is that we shouldn't have separated child psychiatry and youth psychiatry, because like in other European countries, there's child psychiatry and then adult psychiatry. But now we have this one kind of transition step more when we have youth psychiatry. And there are unfortunately some dropouts when you're moving from one stage to another. So that is one problem in my opinion. But all in all, I think that children are very well very well taken care of in mental health skills.
Good. That's a positive note. Emily, I have a question from the audience, and I'm hoping that you can help me answer. It's a question from Daisy Reese Evans. It says research suggests that those who work in healthcare and construction are more at risk of poor mental health. How do we tackle this at an industry level? I wonder if you could take a crack at that.
At an industry level, I'm not sure that I'm the right person to be answering the question, especially when it comes to the construction industry. But it really, I think, loops back to what we've been saying all the way through about taking stock of who is particularly vulnerable to mental distress, going right the way through to mental illness. Particularly during 2020, we've seen that healthcare workers have been particularly exposed to mental distress. I don't know if Celso wants to say something on this as well, but we've seen that people working on the front lines of COVID have been confronted with new forms of difficulty. Even health workers who were used to very, very challenging circumstances in their daily work were experiencing things that they hadn't before. So it's critical that they have the low threshold support, but also access to more intense forms of support. So low threshold support for those groups might be things like peer support networks, or having information available to them, or having someone that they can speak to at the end of a shift. And then higher threshold forms of support might be things like brief psychological therapies, access to medication support, or if people need it, longer term forms of mental health support. So thinking about that continuum of risk right the way through to a need for more intensive interventions is critical for when it comes to all mental health needs, including for people who are experiencing particular vulnerabilities. And that at the moment definitely includes healthcare workers.
Absolutely. So also you heard Emily with some ideas, about accessing medical services and having proper support networks for people in industry and in the healthcare sectors. Have you seen anything actually that works also in Spain, that especially for mental health or for healthcare professionals throughout the COVID pandemic?
No, not really. I've not seen. Actually, when it comes to construction is probably one of the few jobs that have not stopped in Spain, not even during the lockdown, that they were able to continue working. But as it has been said, I mean, with COVID-19, the professionals that clearly are or have increased the risk of developing mental disorder are health professionals. We have just published meta-analysis of all the studies published so far on the physical and mental consequences of health professionals during the pandemic. And around 30% have developed an anxiety or an affective disorder. So that's huge. And that's like, I don't know, but 10 times more than what should be expected. And that happens for many reasons. One is not only the amount of work, but the conditions, the triage they have to do, the not knowing what is the etiology, seeing people dying that will not die under normal circumstances if they were not, or the system had not collapsed. Fear of infection, fear of taking the infection to their people they live with. So there are many good reasons why that's happened, and we clearly need programs to take care of those who take care of the population.
Absolutely. So now we're seeing some questions from the audience, really asking again, what can the EU do? So Maria, I'm going to bring it to you. Two questions. First, one from Anne Clement, asking, what can the EU do to ensure a standard level of care for special mental health needs individuals? Does this exist? And how can we make sure people know about this? I also am curious, so I want to ask that question, but we do see some politicians who actually have prioritized mental health. We have Stella Kyriakides, the health commissioner, who's a former child psychologist. Simon Harris, when he moved from the health to the education portfolio, invested money into child psychiatric services. But are these politicians really doing enough to make sure that mental health is on the political agenda?
Well, to take the your last question first. I'm delighted you mentioned Minister Simon Harris. He's a colleague of mine and moved into the portfolio from Minister of Health as we had a general election, moved in from there into higher education. And you can see instantly, even in the months he's taken on the new portfolio, that raising awareness on mental health, talking about consent, looking at the impact decisions have on our third level, trying to even lift the stigma and open up the mental health conversations around adult literacy that is very high here in Ireland. So phenomenal work, and certainly understands the implications of mental health. And then you look at our health commissioner, who, to be honest with you, if serendipitous was a word, this is why we in the Mental Health Alliance, in the Parliament, and our work with Hilke and her team, is really excited, because we have a perfect avenue now, because we have a health commissioner that understands the impact of mental health, that is really vocal and I remember her hearing and asking questions around health overall, and I remember her saying, mental health needs to be treated like a thread in every little piece of legislation, policy, commissioner, whatever it may be. It has to be the common thread, like what we talk about the Green Deal, like we talk about digitalization, but mental health has to be there. And that really lifted someone like me, who's new into party politics, who's new into Parliament as a whole, to understand that, right, making mental health a competency is not too far off in our reach. Of course, as the generation that I am, I want it tomorrow morning, and I want it fully funded, and I want everybody to have the support services that they have. But unfortunately, that's not where society or politics in particular works. But for that, there is great movements. We're in a great position, and if there's any positive COVID, is the fact that we now have an opportunity to work with all stakeholders and organizations to make this at the forefront, and that in the next years that we are not in 10 years time still talking about and still trying to support citizens who went through COVID in 2020, like we have done in 2007, 2008 in the financial crash, that lost generation of folks who left parts of the European Union because they just couldn't support, and now returning home or sorry, I nearly dropped my phone there. That's a sign I should move on to my next question, Gillian. I take that as a sign. And then in terms of the first question, in what if I'm right in saying what the European Union or what the EU as a whole can do in making mental health, am I right in saying that, Gillian?
Yes, you are. Yes. And I
Yeah.
am conscious that we're running out of time, so just a little bit longer.
Sorry, I'll go like 30 seconds and say it's not there yet, but it needs to be. And this comes where we've seen the response of COVID and how quickly everybody worked together. And I think that in the short time that I can answer this, that energy still needs to continue on long after COVID. Vaccine has been issued, and that we have a mental health crisis, which I do believe is our next pandemic, is going to be the mental health if we don't get it right.
Absolutely, Maria. Yeah, mental health is the next pandemic. I also hear that impatience in your voice to get the EU to do something about this, finally. It's not only from you, but from some of the other speakers. Now, I mean, we're running out of time, unfortunately. This could be a conversation we have for a very long time, and I hope we continue this. But I actually want to end on a pretty practical question. Kodrina wrote to ask, what activities can people do while they stay at home during the pandemic in order to improve their mental health? And I was wondering if Celso could maybe answer that. Some practical advice to end on.
So the first thing I should say is that many times I'm asked what are the consequences of the lockdown, of being at home, and I always say it's completely different depending on your background. It's not the same for a family with 5 children, one of them with intellectual disability or autism, that live in a small flat, and a family that does not have anyone who is has any disability, live in a really a large house. So it will depend a lot on anyone. But something which is very clear is that we need routines. We need to we're used to, as human animals, we're used to do things in a certain way and a certain order. And we need to change that routines, but we need to have those some. So we need to, wake up at a certain time. We need to do like exercise. We need to do social networking. It can be done through the virtual and computers and internet and so on. But we need to change the routines, but have a routine that we do every single day. And it's not the same if it's a Saturday, Sunday, or it's a Monday. There has to be differences.
Absolutely. I love the idea of routines, especially as we move into these colder months and hopefully can go for some chilly walks. I want to thank you all for watching today. Thanks to all the speakers for participating. I hope this is really just the start of a much longer conversation. I also want to thank Angelini Pharma for making this conversation possible. I want to remind you, too, that you can send your feedback to events@politico.eu and Politico will be hosting more virtual events this week. You can check out what those are online. Thanks so much, everyone.